Bernie Klein, our CEO, the person who allows us to be the patient-centric group of caregivers that we have become. And it is no more evident than the fact that we have a greater than 90% patient satisfaction on the last set of surveys that Press Ganey did. Not only is that pretty much one of the highest scores that you can have in Southern California, we were the top score in all of Providence health system on top of it, and very proud of that. And most of the people who are working there all have been patients. Myself, I was actually born there. Most of our families have had the opportunity to be patients there, and we really do take care of everybody as if they were a family member of ours, and not just that black sheep of the family, but actually a family member we really, really love. So the care is absolutely outstanding. It's a 377-bed hospital, and you really can't miss it. It's right there on Rinaldi between 405 and the 5 as you're dropping into the north end of the San Fernando Valley. And you're going to see our name cropping up in small little areas here in Santa Clarita, like on the corner of McBean and Valencia, where we have a beautiful building where we have a lot of our physicians. Hopefully maybe having our Providence Medical Institute and our board of experts, one of which you met a few months ago, Dr. Tiffany Avila, neurosurgeon extraordinaire. And our most recent introductions and news comes with Children's Hospital and our affiliation with them, working within our neonatal ICU, and they're 24 hours a day making sure that patients, our little ones, and their families are being cared for at the utmost to allow for a very expedient recovery. And of course, our very exciting news, being a part with City of Hope, bringing the highest level of oncologic care for cancer and other disorders that City of Hope you would normally have to go to Duarte for. Now we're bringing it into our own backyard. Anytime we have the ability to do that, it's going to take the stress off the patient, stress off the patient's family, and allow us to bring the medicine to you, so we can't be any more excited about all of that. Providence Holy Cross, of course, being adjacent to Santa Clarita, probably the third largest health system is Providence in the entire United States. And we enjoy being the fact that we're not-for-profit, so everything isn't about hitting the bottom line, and everything isn't making sure that there are dividends being paid out, but more so is just making sure we're delivering the highest quality of care, the most up-to-date care, and allowing for patients to be effectively and efficiently cared for in every way we possibly can for the best of outcomes. Now, you can reach us easily through our regular phone, which is 818-365-8051, or through our 888 number, which is 888-HEALING, 888-432-5464. And you'll be able to find us easily, again, off of Rinaldi, right next to the Alamany sports areas, and we are here to assure that our community is going to be best cared for. Now, let me tell you, I'm really excited today having the opportunity to bring our guest in. As you know, I have said I am a physical therapist, and I was a treating therapist and manager at Holy Cross from 90 till 2006, and I have had the distinct pleasure to work alongside our next guest for this month, and a little bit about her. Now, I've been doing this about 27 years. Our guest has been doing it about 22 years, having gone to UCLA and my son graduating from UCLA. This one kind of irks me just a skosh, being a graduate from USC, but also as a provider for the Pac-12 and during their tennis championships and swimming championships, I can say that I can support that Pac-12 school, and USC is okay by me as long as we're not hearing anything from the city of Troy, which would be just fine. I was just commenting to a family member that the Rams had probably one of the largest attendance that the Coliseum's been able to put up over the last bunch of years for obvious reasons. Anyway, so graduate from USC, practicing for 22 years, the inpatient director of physical therapy, and good friend Stacy Williams. Welcome, Stacy.
Hello, good afternoon.
And Stacy was a little reticent about coming on to be able to do this, and so everyone just kind of throw out a warm welcome wish in our direction here, and I think we're just going to go ahead and jump right into it. And first off, it's always interesting to find out why physical therapy.
Well, it was funny. You were saying you were born at Holy Cross. I was not born at Holy Cross as you were, but I was actually born at St. John's in Santa Monica. And St. John's in Santa Monica is now part of the Providence family. So I kind of feel like it has come full circle. I, work for Providence, and back in the day, had it been Providence, I was born at a Providence facility. So, I actually was pre-medical when I went to college. I went into college at UC San Diego with the goal of being pre-medical, and changed my focus a little bit and wanted to do something in healthcare that could get me out of school a little faster and wasn't 10 years of residencies and everything else. And physical therapy really fit the bill for me. I had physical therapy as a child. I was an athlete and had mild scoliosis and some other issues, so I had interacted with physical therapists 2 or 3 times, through my youth. And it just really seemed like the right career for me, and it has definitely been that right career for me.
Excellent. Well, they do say that the perfect second car for someone whose car always breaks down is a tow truck. So theoretically speaking, for athletes who are continuously getting hurt, best that the physician heal thyself, and to actually learn all the tricks of the trade to be able to make sure that you're going to stay healthy and be able to go out and help all those others. So what were your sports?
So in high school, I played volleyball, basketball, and softball. Kind of pared it down the last couple of years to just volleyball, but developed tendonitis, severe patellar tendonitis, really bad knee pain, which haunts me to today. So I certainly use my physical therapy principles to self-treat for that, and warn my children about tendonitis. But yeah, I just always enjoyed being involved in sports. And what's nice about physical therapy is you're involved in the medical field, but you're on the restorative end often. We definitely do see patients who suffer more and are in the hospital and have other ailments. But in general, physical therapy, we're really working on restoring their function and getting them to be able to return to their prior level of function or the activities that they enjoy. It's a very rewarding career.
It is, and it's nice too, and I appreciate you letting us to get to know you a little bit. That is one of the things we find with our careers, that we do have a lot of time where we get a chance to speak with our patients. It's a little bit more personable, and not only do you get to know them, but they get to know you as well. And oftentimes to this day, you still probably get an occasional email or a note just thinking of you, how's everything going? And I can't say that I get that an awful lot from acquaintances that I've had outside of the clinic.
Yeah, it's just nice because again, we sometimes feel like we're part social worker, part coach, part therapist, motivational speaker, because again, the patients are going through so many issues, and they really do open up to us, and we're helping them get through sometimes the toughest thing they've had to do in their life, and working hard to regain their function, and that sometimes involves pain and involves a lot of hard work and exercise, and just the reward of seeing that end result where they're able to get back to playing tennis or get back to walking or walk their daughter down the aisle after a stroke, or just amazing outcomes often that stay with you for your life.
And it's interesting too with the work that we do that it is a calling, and I remember seeing that once on our website, that it's something you kind of want to do, not that you have to do. Type of a thing. And interesting with Holy Cross, there's a very strong sense towards the mission, very strong sense towards our core values, that a lot of the caregivers here really actually do follow and feel very comfortable with. And we are in the presence of greatness. Stacy is a Mission Spirit Award recipient, Miss February 2003. No, the staples didn't hit her in the belly, which is fine. And kind of a neat honor, because that is something that your peers put you up for. That other people had the opportunity to actually observe the work that you do, not just in one instance, but in every instance, and they look at that and go, this person's pretty special. And then it goes amongst a board of the mission leadership and previous award winners, and you were an easy choice.
Well, and it was interesting because when I hired on at Providence, I had just had my second child, my daughter, and I was working per diem and registry, which again is another benefit that physical therapists have. Nursing and other specialties like respiratory are actually able to work registries, which are like temp agencies. So if a hospital has somebody out on vacation, they call these agencies and get a physical therapist for a couple weeks. It's the same with nursing and respiratory and other disciplines. And it provides a lot of flexibility to the career, especially for women who want to have children and have more flexibility in their life. So I was working per diem and registry and hired on per diem at Holy Cross and another local hospital. And I just remember going to the orientation. So it's a 2-day orientation, and you sit there and they talk to you about Providence, and they talk to you about the nuns and how they came across to the West Coast, and really their mission of serving the poor and vulnerable and helping the sick. And their mission was just so clear. And in orientation, I just remember sitting there and thinking, wow, they really want you to buy into this. This is their goal. I am part of this bigger plan. And it's something that they reinforce at Providence all the time is, are we really fulfilling our duties and living up to that original mission of the nuns? While we don't have as many of the sisters working in the hospitals as we did in the past, often the sisters were administrators and were nurses up on the floors and worked clinically with us on the floors. Not as many these days, but again, we are really the stewards of that legacy and carrying that legacy on into the future years. And our mission and our core values is something, again, in orientation that they just stressed very heavily. We have our core values are excellence and stewardship, compassion, respect. I'm missing one, I think.
I think we're missing one. Hang on.
Justice.
Justice, right.
But again, those 5 core values, they're all throughout the hospital. They're celebrated through Mission Spirit Award winners, which I was fortunate enough to get and felt very blessed that my coworkers nominated me for that. But you see it living in our daily work and in the hospital. And I think our patients see it, because again, that compassionate care and justice in the way we do our work and the way we care for each other and respect, and patients feel it and see it and know that. And I tell people all the time, Providence runs their hospital in a way you would hope a hospital would be run. Making decisions, no matter what, every business has to make difficult decisions and make decisions that will keep them going as a business, but they do it in such a way that it really is respectful and in a way that you would hope a business would run themselves. And I think that's what keeps people there. I've been at Providence 15 years now, but many of my coworkers have been there 25 years, 30 years. So if anything, at 15 years, sometimes I feel young at Providence. And I think that longevity speaks volumes.
It does, and it was something that I'd shared with Dr. Klein last month. But I really do believe that a lot of success, especially when it comes to being driven towards core and towards mission, that a lot of that is really brought from above. And that is the one thing that we actually have. Our entire C-suite, our CEO, our COO, CNO, our CMO, our CFO, any other letter that I missed, they all purport that, and it's obvious in their discussions with us when they come around and do their huddles, which occurs on a pretty regular basis to keep us informed of what's going on. That I think it actually, when we see it practiced with them. And practiced with a lot of our physicians, that it makes it a lot easier as caregivers to learn from that and see that it's okay and that's what's expected. So if the big wigs are willing to do it, then by all means we're going to be willing to do it. And it's true. And no better deserved reward than you receiving that, as well as the social work award as well. So we are literally in the room here with a presence with Holy Cross, though she Stacy won't really allow you to go too much further with that, and which I do understand. And we want to next in the next segment. I know we're going to be breaking for commercials in just a second here. We're going to start taking a look at what actually is occurring within our rehab department at the hospital. Not only just physical therapy, occupational therapy, speech therapy, not only on the inpatient side, but on the outpatient side, some of the ancillaries that are involved, like with lymphedema perhaps, and take a look at also what occurs with acute rehab and see how we can bring a little bit of understanding and shed a little bit of light on the offerings that are there and the skill of the staff that will be able to deliver that care to the community at large and to Santa Clarita as well, to help make that choice to do your recovery with us. And so I think with that, I think we're going to go ahead and go to break. You're with us here on KHTS 1220 AM, your hometown station. See you soon.